Good evening. As you know, I'm Larry, and I'd like to tell you about my battle with cancer and mostly my experience with NYOH. I'm now 80 years old and stand before you as a two-time cancer survivor. My first encounter was in 1999 with prostate cancer. I allowed myself a 2-day pity party and then set off to discover all I could about prostate cancer. I'm an engineer, and if you know other engineers, you know we want to know everything. I wanted to fully understand this disease. I discovered a great doctor at Albany Med, had surgery, which was totally successful, and I've been cancer-free of prostate cancer since. Okay, now, cancer can be checked off the list along with having had poison ivy, measles, mumps, and chickenpox. In 2008, I had two very close friends that were 74 years old that appeared to be in excellent health. They were trim, didn't smoke, just social drinkers, were very active, but suddenly they both had severe heart attacks. One was airlifted from Aruba all the way to Fort Lauderdale, Florida. Fortunately, both have survived. Wow, that was a wake-up call for me. So I thought maybe I should have our carotid artery ultrasound scan and get an assessment of my coronary arteries. This was pretty inexpensive at the time. I discussed this with my primary doctor, who suggested that a cardiac calcium scan, which is a CAT scan across the center of your chest, would be much more telling. Okay, sign me up. I had a scan which indicated my heart and coronary arteries were excellent, but there was a small shadow on one of my lungs. Well, at this time, I'm about 3 days from a prepaid 3-week Florida Keys vacation. So my primary doctor and I agreed I would go on a vacation and deal with this when I returned. Other than my wife, I told no one. So when I returned, I had a neck to pelvis CAT scan, and lo and behold, there's a large cancer on my left kidney. No pain, no urinary evidence, no other signs at all. I thought I had checked off cancer off my list, but that was not to be. The doctor that removed my prostate had a partner that did kidney surgery, and his buddy, a thoracic surgeon, would remove the spot on my lung while I was still in the operating room. They said they could all do this laparoscopically. I'm thinking, you're going to remove my entire kidney, along with the tumor, through a 2-inch incision. A piece of cake, they said. One overnight, a big breakfast, and I go home. Okay, now, check off kidney cancer from the list. Well, about 3 to 6 months later, there are half a dozen small metastases, mostly in my lungs. Apparently they were microscopic, and with a little time, grew to be detectable. My surgeon then referred me to NYOH. Up until this time, I had some really great doctors, but now I met this doctor who was unbelievable. We had a thorough conversation. Remember, I'm an engineer and I want to know everything. Maybe I'm a little bit of a pain in the ass, but he's very patient. He says that treatment with drugs is the only option. Now, I'm at home and I'm on the internet, like all engineers, and I'm Googling kidney cancer. Well, the survival rate doesn't look all that good. Now, this new doctor had given me his email address in case I had any questions. Would I? So I shoot him off an email, expecting that maybe tomorrow I will get a reply. It's rather late in the evening, but less than a half an hour, I get a response. What you found is not completely accurate. We've made some good progress in this area in the last few years. So these email exchanges go back and forth for weeks, and I always get a quick response. You would think that I'm now an oncology student. I started my first chemotherapy. At home over the weekend, at about 9 p.m., my wife says to me, "Your doctor is on the phone." I said, "No, that can't be, because he's on vacation. I know that." So I answered the phone, and he says, "I'm in Nantucket, and I was just wondering how you're feeling." So now I'm feeling like a real celebrity. This was not the only time he phoned while on vacation, as he also called me from Maine on another vacation. Well, the initial chemo did not go well. I couldn't leave the couch. I'm living on mandarin oranges and orange crush. Everything else tastes like cardboard. I told the doctor I could stick this out for a month or so, but if I have to do this long term, this is not going to work. After a lot of tests, he gets me into an ongoing study using two drugs that have already had some success with treating kidney cancer. I think I'm the last patient from the state of New York admitted to this study. But I start on a 2-year program of a daily pill in regular CAT scans, echocardiograms, EKGs, blood tests, and infusions with an autoimmune drug called Keytruda. The study finished. Many patients, including myself, made significant progress, and the drugs were then immediately approved by the FDA for treatment of kidney cancer. I'm now drug-free, returned to my normal weight, and the metastases have been stable for over a year. My wife and I recently returned from a month in the Caribbean. Life is good. So this accidental finding of the cardiac calcium scan probably saved my life. Perhaps someday a CAT scan will be part of an annual checkup. It might have saved some of my dearest friends. Everyone at NYOH has been fantastic, professional, friendly, and compassionate. From the check-in staff, scheduling, the staff in the infusion room, along with the study nurse, Alicia Ray, who kept me and my wife's spirits up. And I'm pleased to say I met a few of those people here earlier this evening in the meet and greet. Last, but certainly not least, I would like to personally thank my doctor for taking this journey with me. He is not going to like me calling attention to him, but will Dr. David Schaefer please stand up? Thank you, Doctor. Thank you all for coming and supporting this foundation. Good evening.